this study, we were interested in the prognostic implications of abnormal split lung function as detected on ventilation perfusion scans post-lung transplant. Lung transplantation is one of the few effective treatment options for patients with end-stage lung disease. Unfortunately, long-term post-transplant outcomes remain challenging in part because the lungs are directly exposed to the external environment. This makes identifying early prognostic markers of dysfunction essential for timely intervention and management. Lung ventilation perfusion, or VQ scans, are comprised of a pair of nuclear imaging tests in which radioisotopes are used to measure breathing and circulation in the lungs. Our program performs routine VQ scans at 3 months post-transplant to assess baseline lung function. However, the implications of abnormal findings are unknown. One important quantitative parameter obtained from these VQ scans is the lung perfusion differential, which tells us about the relative distribution of pulmonary blood flow to the right and left lungs, adding up to 100%. A 55-45 right to left split is considered a threshold of normal since the right lung is larger. We can think about split lung perfusion quantification as a radiographic assessment of lung function because it also tells us about the airways and the state of pulmonary ventilation. And this is because of hypoxic vasoconstriction, a homeostatic mechanism in which blood flow is restricted from going to regions of the lungs which aren't being ventilated. Now, we hypothesize an imbalance in relative lung perfusion beyond this normal 55-45 split at 3 months post-transplant would be associated with poor long-term outcomes in terms of survival and secondarily lung function. We broke down lung function into 2 dimensions that's captured by 2 types of dysfunctions. First, we have chronic lung allograft dysfunction, or CLAD, which is characterized by a permanent 20% or greater decline in forced expiratory volume in 1 second from the patient's personal baseline. Baseline lung allograft dysfunction, or BLAD, addresses a separate risk group of patients who aren't able to reach a normal level of lung function, defined as at least 80% of the standardized population-derived reference spirometry values. Of the 340 double lung transplant recipients between 2004 and 2016 who met inclusion criteria, 169 or 49% had a relative perfusion differential of at least 10% on a 3-month VQ scan. Here we have Kaplan-Meier curves showing the results of our time to event analyses for survival and CLAD. We see that the group with unbalanced perfusion on 3-month VQ scans, represented by the dotted lines, had impaired survival and secondarily increased CLAD onset as compared to their counterparts with balanced perfusion. We also found that baseline dysfunction is more frequent and more severe in the wide perfusion differential group. That brings us to our conclusions. Abnormal lung perfusion differential is common after lung transplant, but is associated with increased risk of death, poor post-transplant baseline function, and CLAD onset. As such, we feel this measurement warrants further exploration as a potential predictor of future lung dysfunction and its related risks.